and welcome to the Anatomy of Therapy. I'm Dr. John Cybulski here with Bobby Riley as always. Today we have a very special guest who is really good friends with Bobby from way back when, and I'm going to let you kind of take this away, Bobby. Who was our guest? Tell me all about her, please.
Well, luckily my wife was good friends with her in chiropractic school, so we have Dr. Clare now for many years, right? I went to your wedding. How long have you been married now?
It'll be 8 years in August.
Wow.
I know.
Okay.
Congrats.
Yeah.
Old.
Yeah, we went to chiropractic school together in Minneapolis, Minnesota, and she was in the same class as my girlfriend at the time, married now, wife. And and I think, and I've seen Katie many times through the years since then, but in the last few years, she's made some strides on the old Instagrams, doing very well. So, I mean, maybe just I am curious personally, like where you started, kind of maybe what's different from your background than typical chiropractic background, because I kind of know where you came out of school, what you were doing for your internships, and where you are now. And I know you have your own practice and awesome stuff like that.
Yeah.
So
yeah,
if you could dive into that.
Sure. So a little bit of my story is it was so great that I met Jeannie in chiropractic college because I got about halfway through school and I was like, I feel like I've made a terrible mistake. Like it was a ton of straight chiropractic philosophy not fitting with me. I was like, oh God, what do we do now? You know, we're halfway through this program. And then I happened to land into a sports internship, which like brought me all the way back around. They did a ton of rehab, prehab, like people are getting stretches. We were working on movement assessment. We were giving rehab. It was people that were active in CrossFit and other athletics. And we were really looking at what they needed specifically for their issue. And that was so much different than kind of the crack them and they're out in 2 seconds. So along with that, we did a ton of like manual therapy, which is something that I know is like a hot topic item in a kind of the industry right now. But it kind of was something that just brought everything full circle for me. So I did a ton of training through that, and it was a lot of, I know, Bobby, we have similar upbringings in this, I guess. A lot of the transverse friction massage, you know, really hone in on what muscle structures giving you the issue, slam on that therapeutically for a bit, work on if there's any other, you know, structural things that we can stretch out, a lot of like active release technique, myofascial stuff, and then chiropractic adjustment, mobilization, and then exercises, really make them as self-sufficient as possible. So it's kind of like where I started.
I don't know if you knew this, but I had like the same story where when I was after 1 year in chiro school, I knew I had one other class I needed to take for pre-med. So I was taking physics 2 at night in Bloomington.
Yeah.
And I was volunteering at the hospital in the emergency room.
Oh, dang.
Because I needed more like kind of experience and for my resume, because I was going to med school. I was like, and I took the MCAT, like maybe on the 3rd or 4th try in chiro school.
Really?
I took the MCAT. I was in like the library at chiro school studying for the MCAT, like for a couple months. Yeah. And I was like, I'm out of here. I'm going into trauma surgery. I wanted something very objective. You know, I hated the subjectivity of it, but I didn't know your story like that either. So it was fascinating.
Yeah. And it was, you know, when you're a first year and everyone's at the holidays and asking you what you're learning. And I just remember I was like trying to explain like chiropractic philosophy, and like, I can't sell it if I don't believe it. And it was just a fumble fest. And I was like, oh God, what is going on? So then I got into the sports medicine and I was like, this clicks, this resonates, this makes sense to me. And so that has been, you know, smooth sailing ever since. So yeah, that's kind of how I started. And I would say I have evolved as a practitioner. My first job, I actually worked somewhere for 2 years before I opened up my own practice. And they were, I wouldn't say high volume, but pretty high volume for someone that's doing so much manual therapy. And I learned how to get really good at touch feel. And that was kind of what I took away from that. But then I wanted to look at the person more globally, you know, like someone would come in with a shoulder and we'd be able to fix the shoulder, but then they'd be back with a hip, and now the hip has flared up the shoulder again. And I was like, what's like the connection? Like why does this keep happening? And so that's when I really started to like step out a bit and kind of look at more of like the movement assessment evaluation and looking at someone really head to toe and trying to put together how they're moving, how that their gait, what they're doing in their daily is really affecting whole chain. So I'll start really focal with people, but eventually we get pretty global with it. So if they're coming in for a shoulder, like we start shoulder and then we start to like branch out from there. So I think
how do you start to look at that sort of thing? Like where, like, I mean, I think I love it. And you know, that's how we both practice, but like for doctors who may be in the beginning, like, and see the wider stuff, like what were the kind of first, I don't know how to look at everything all at once, you know, like where did you go? How did you start to get that perspective?
Totally. Fumbling through it mostly at the beginning, just making stuff up. Am I really seeing that? No, like I kind of had a little bit of, this is really happening. I would look at someone statically, you know, just standing there posture, start to hone in on if they're, you know, high, low, like why is the shoulder dropping? Like, is it actually dropping because of upper traps, you know, is one high, low? And then I'd bring it down to the waist. So where I really started to hone in on this is, I don't know if you guys are familiar with the myodetox, Vinfam, all that good stuff. I did like a 1 week intensive with him. And it was just kind of, I wanted something different. I figured, you know, none of the other continuing ed I was looking at had me excited. And he really is like structural integration. So love him or hate him, he gave me kind of a different way to look at how the body moves, what you're looking at, and then take that static posture. And as they start to move, I always had a problem with like gait, like things would just happen too quick for me to process. So if I had a little bit of the static, it at least gave me some ways to like hone in on the movement assessment. And then I just kind of do walk, see what I find with that. And then we bring it to sport specific. So if it's going to be squat, if it's going to be deadlift, if it's going to be something dynamic, run, jump, whatever it is. And that's kind of how I just break it down for me personally, so I can start honing in on some things.
Yeah. Was there any other influences? I mean, because it's been, several years now that we've been out, and I get that that's one, because it seems like you took from your internship and your, like, we call them mentors if we want, and your first job. We get influenced by that for sure. But then and I think this was exactly back to John's point a little bit. We're just so curious about how you take that next step that pushes you in a new direction. So you had that course. I mean, is there anything else that you just kind of either stumbled upon through failure and figuring things out, like you were saying, or? Yeah,
I mean, I think I just keep falling down the rabbit hole, like whenever I'm kind of looking for information. So to kind of like segue in, I guess, like the Instagram thing took off because I was doing solo practice and it was just me. And I was like, I got to do something to like keep learning and keep like keeping myself honest, I guess, with what I'm seeing. So I don't just get into this like stagnant, like everyone has XYZ. So I started just doing a lot of like what was coming in through my clinic, what I was curious about, the cases that I couldn't figure out. Like that's a lot of my, you know, if I'm honing in on something, it's because someone stumped me at some point. And so that was my own research. So I'd fall down kind of the rabbit hole of like, you know, like Kelly Starrett, like mobility WOD stuff. Who's the train, Jeff Cavalier, like, you know, comes from a PT background. Just kind of listen to like all of these different people. And it was a lot of like, like social media influencers, I guess, but it gives you a start point, if nothing else. And just plugging the question into Google, like, you know, then you come across a research article and then that would bring you into all of these other things. So people are always like, what was your path? And I'm like, Google. Like, I just kept falling down the rabbit hole, I guess. That's where videos are what makes sense to me. So as opposed to like picking up the book, like obviously I check my sources a bit on it, but I'm not going to read a book on it. I'd rather like see it happening.
So wait, when you were talking about like, that's how your Instagram started kind of going, you would like, let's just, what I'm hearing, you would have a tough case. You'd be like, this guy has no thoracic spine mobility. Yeah. And then you would see people doing kind of thread the needles and opening up the book. And then you would research that and then you would post some of those difficult things that you would just research. Is that what I'm hearing?
Yeah. Or if it was like, I don't know, runners in Minnesota in the summer, it's like everyone's coming in with IT band stuff. So then I'm like, you know, in your younger days, you're like, we'll just foam roll it or whatever it is. And then you happen down like, okay, maybe it's not, you know, friction, maybe it's more of compression, like you're not actually stretching it, and then just followed that down the rabbit hole that way. But then also have enough knowledge on whatever I'm posting that if some hater comes at me, I can at least defend myself a little bit.
Yeah. So I mean, cause you are like proficient. I mean, you're posting all the time. I mean, I guess someone who's, for people who don't know, Dr. Katie Clare, you've got, I don't know, 1 trillion followers. Is it not? Like, I was like 200 and something thousand followers at this point. And like, she's super active, posting daily. There's like sliders with 25 slides. I don't know how you've gotten access to that. I don't know why you haven't had your blue star, but anyways, posting a bunch of stuff. And I saw on one of your stories, and I also wanted to ask you this, which is, you were talking about the haters on Instagram.
Yeah.
With 200,000 followers, there's no way that you don't get like insane questions. Like, I think, I don't know, it was a month or 2 or something ago, and you were like, oh, I haven't got the tall question before. Like, how do I get taller? I'm like, how, anyways, but then, you know, you make all of these slides, and I imagine that in the back of your head, you're like, okay, what are they going to ask that I can get ahead of within this like series of things? Am I wrong with that? Like, how do you, so you've researched like an IT band or something. You've got like 5 or 6 cool stretches, exercises for it. But like, what can you walk us through like a little process of like how you're going to make a post? Like, I would be fascinated.
Yeah. It's funny because I used to record them at my gym, and like one of my followers / friends at the gym was like, oh, this is how the sausage is made. And I was like, ooh, behind the scenes. All right. But I don't think of it like that. So I guess what I do is kind of how I would handle it with a patient that walks in through my door. So I'm going to try and give them, you know, at least some sort of like myofascial that they can do on themselves. Because like whether you're pro manual therapy or not manual therapy, like touching or rubbing the area is helpful generally. Then I'm going to try and give them at least like a mobility something, and then a strengthener, because the strengthen part is really what people, you know, it's not instant gratification. So that's what they kind of lose out on. So I just kind of take it that way for a lot of things. And then I have really been trying to do, I feel like if I do too complicated, I get a lot of people that are like, well, how does someone at the beginning start? And then if I keep it too simple, people are like, I passed this a long time ago. So I've really tried to like intertwine back and forth a little bit, but you're going to get people that like, you know, they're either way past it or they're not that advanced yet. So they're not going to like it either way. Then I'm pretty middle of the ground for a lot of my just like my, how I kind of operate things too. So I don't feel like I'm out there saying like really outlandish stuff. I don't know if you guys saw the recent drama on the social media in the last week or so. So I'm pretty midline like that. So people don't come after me real hard for a lot of things. But if they do,
we missed the drama.
So there was a post
I mean, if you want to.
It wasn't my drama, so
Okay.
I hate to like reiterate it, but there may have been a post from a big account that said high-waisted pants might shut off your core.
Oh, sure. Yeah.
And some people had major issues with that. So I don't come out with any of that. So I kind of stay pretty midline with it. So I don't get a ton of like backlash.
That did get a lot of backlash. That was fun. I saw people like posting the anti high-waisted pants, shut off your core. And I didn't know where it was from. I was like, oh, who said this? And then I saw the post. I was like, oh, those guys. It's fascinating. But here's the other thing too, that I mean, I'm sure I've said things on this podcast that are just absolutely insane. Like they're like, with the amount that people like you and those people, we won't mention their names, who post that much, have that much content out there, like how you're gonna anger somebody. I mean, that's a little bit crazy of a statement. I don't think you're saying anything like that, but but still you have to kind of step out at some point and like, you're like, I know there's going to be people that hate this post. There's going to be someone out there, but I've just got to do it. Like, how do you get through that? Does that make sense? Because I know that there are a lot of people who want to become, want posts like, pages like yours, but they're a little bit held back. Like, how do you fight through some of that stuff?
So I would say when you are forming your community, your tribe, whatever you want to call them, it's pretty much all love in the beginning. Then eventually you get a post that kind of blows up, and that's when people that aren't following you, that just want to troll, come from. My experience has been. My big, most recent was I used curtsy squats as a demo for something, and it was like, I don't even know, but they were like students of strength and conditioning, like not even coaches, strength conditioning coaches, coming after me hard. And they're like, you're going to blow your ACL out. I was like, why don't you tell every woman that does any HIIT class, or tell any dude that, and so I had the community form that a lot of people, educated people, kind of, came to my defense, and probably had to mansplain it a little bit on my behalf to them, but I'll take that. But at the same time, if you don't give the hate back to people, if you just really take a breath before you respond, generally it doesn't like blow up into something super crazy. That being said, you get trolls every once in a while. Like, I'll just block people too. So if they're just like vulgar and not there to actually learn anything. So you have that power as well. New Instagrammers starting out.
Well, and I read your comments sometimes under your post as well, just to see how you take these things, and you're always very good with them as well. And I think people who don't know you personally, or only know you through Instagram, can't possibly come to grips with the fact that you might think outside of just what you post.
Mm-hmm.
Like, you do a good job of saying, hey, if you have this type of issue, try these things. And then people will ask you all these questions underneath, and you're like, hey, it could be this, try it. If it doesn't work, try something else. If that doesn't work, go get a therapist, get somebody professional, and that says a lot right there, because you're not pretending to solve people through the internet. You're just giving people a lot of good options to try things.
Yeah.
And even the experts, or the doctors or chiros out there, they can still get ideas from it. I mean, that's where I follow. We all know that we can keep only a handful of exercises like on the top of the mind, and then I'll see something from you and I'm like, oh man, I haven't tried that in a long time with a patient. Why don't I vary it up or try something else? But I did also, like, a while back, you said something about like accountability to yourself. And sometimes when I take your little quizzes on your Instagram stories, I'm like, oh man, like, I don't know if this is the right nerve. Like, and it's a good way to keep yourself, accountable in a way, because, we think we know everything sometimes and we can fix everybody's problems. And then you're asking me what nerve goes to the quadratus femoris. And I'm like, wait a minute. Like, I don't know if I've thought about this in a long time.
Yes.
And it's so how much has it actually helped you? Because I know it's not the same mental process as when you're in front of a patient in the office, right? I'm pretty sure you can tell me that's totally different.
Mm-hmm.
But what has it done for you? Or do you feel like it's more for other people?
Interesting that you say that. I kind of do. I feel like it is a bit more for other people is what it's turned into. Which is totally fine. Like, I get messages from people all over the place that are like, I was doing your low back post and it's like brought my everyday pain down, blah, blah, blah. And I was like, wow, could you talk to my patients? Like, I can't get them to do it sometimes. So, but it does give me more diversity in exercises, I guess. So the people that come to me, two things, actually, let me back up. Sometimes I get really weird cases from people that have found me from Instagram because they've literally been to everyone else that can't figure it out. And I'm like, I am so blessed that you think that I'm going to be able to figure this out. But the reality is, like, you got something crazy happening. But it kind of gives me like a different jump point for them. So what I've learned is if people have done the rounds of PT, they've done the rounds of whatever, the history they come in with, like, if they've done bridging and clamshells and they hate it and it hasn't worked, like, cool, we're not going to start there then. So then it has given me kind of like a different exercise database in my brain, I guess. Like, let's start this, let's start there, see where you get. And then I think it was someone that you had on recently that said, if they're not going to do it, like it's pointless to give them that exercise. And that's totally true as well. So what it's done for me is giving me a different database, but then I also can go back and reflect a little bit. So then next time I see them, or I'll email them like, hey, I was thinking about your case. Let's add in these 3 other things. And sometimes that's something that kind of pops them up to the next level.
Yeah, it was funny. Like, I think one of the first recordings John and I ever did, we brought up this idea that Stuart McGill maybe has a much easier job than most clinicians do.
Yeah.
And it was based on that idea that by the time they get to him, it's so narrowed down. They're not going to be some acute disc patient. They're not going to be a standard sciatica. Like, by the time they get him, he already knows he has to look for the kind of crazy back problem. So it's funny that you mentioned that. And I think, yeah, it doesn't necessarily make it easier. Like, I was kind of joking that McGill has an easier job, but by the time they get to you, you can already surpass a whole bunch of things and look elsewhere.
Yes, totally.
Yeah. John?
Yeah, no. So I mean, so like Instagram has obviously impacted the way you've got a different database basically for patients that you kind of see. Okay, so we talked also about the trolls a little bit too.
Yes.
Have there been any, like, maybe they meant it for evil, but you used it for good, where you're like, okay, that's actually a reasonable question, like, where you started to put up those quizzes. I mean, and I also saw, this is what I was going to say. You had a story where you went through and you were answering questions. And I feel like a lot of times where it was awesome. It was really awesome because sometimes doctors will be like, oh, you just give people 5 exercises for their back. How do you know that helps their back? And I'm like, read the blog post that she writes underneath. A, it's a big piece of it. But B, like, how has it switched? How has it changed? You've been doing this for a little while, like you said, you give the mobility, you give the strength. What has happened where there has been drama and you have started to make kind of those changes from Instagram?
Great question.
Longest question ever. Let me just confuse you even more.
It was good. So are you asking like philosophical, or
no,
how
like,
I handle things?
did you give too many mobility things and then you started giving more strength things? You gave too many strength things and now you give mobility things, but there was just like, it's all going to be mobility and now someone forgot it. Like, what was it? Did you always give a mobility, a strength, a stability exercise? Do you know what I mean? Like,
yes.
Okay.
Yep. Okay. So how it started off with a ton of strength, actually, because I felt like that was the missing piece for a lot of people. It's like back to the IT band thing. Like, I foam roll and then I go back and everything falls apart again. Like, what do I do now? So then I started introducing the strength aspect. Like, that's how I approached it initially. Like, we're going to just strengthen everyone. But then when you are trying to build a following, if you are trying to attract people to get your message across, you have to give the people what they want a little bit too. And it's like always mobility. Like, everyone always wants mobility. Yeah. So I not cave, because I think that is important. But I try to do some posts that are like straight mobility, and whether, I don't know if I put this in my captions, but in my brain, I'm like, if you're doing this slide of 5 mobility exercises, cool, but you have to strengthen it too. Sometimes I fight that battle, and on some posts I don't, or I just bring it as like, this is just a mobility post. So I guess that's kind of changed a little bit. And I think a lot of people come in, if they are just finding me off of Instagram, perhaps thinking that it's going to be like we're going to just really beef up their mobility work. And a lot of times it's people need stability. So I'm like, well, I hate to break this to you, but we're going to strengthen those glutes, and those planks that you hate doing, like, we're going to do some planks too. So yeah, I guess that's kind of how I take it.
No, that makes a lot of sense, because I think as doctors, we all kind of run into it at some point where they're like, I need to be more flexible. And you're like, sure, okay, but we've done that. Yeah. Like, and I don't think you're right. It at some point it feels like caving, but like, kind of what you were mentioning before that one quote, you have to kind of get the buy-in first, right?
Yes.
What do you think, where have you found that you're able to get people to transfer from, the mobility craze to, and if it's appropriate, to that strengthening? Does that make sense? Like, where does that light bulb go on? How do you get that light bulb to go on for your patients or for your following, to switch over from that mobility craze to something they might actually need?
Yeah. So I don't know if it was a phrase that I picked up from someone or just kind of made sense in my brain, but the phrase that a weak muscle, I say, will generally feel like a tight muscle. And I mean, that's boiling it down to its base a little too much. But when I kind of say that to people, like they're like, I feel tight. I'm tight. I need to stretch. Bring up kind of like sometimes if muscle is fatigued or it just doesn't have that endurance, a lot of times it's going to give you the same signal that it's tight. And is it tight because it's actually tight? Is it tight because some other structures are about ready to blow out? Is it tight because it's actually just craving some endurance? When we say that, then a lot of times people have already gone through the stretching and the mobility, and then that helps them kind of connect it a little bit quicker. Like, oh, maybe this is something else that's going on. Maybe this tight, quote unquote, muscle is not my enemy. Like, maybe we need to figure out a bunch of other things too. So I think that helps people. It helps me too, like I'm human. Like, I'm like, oh, this is tight. Like, I want to stretch it out. It's like, no, I need to do my chin retractions or something, and then I feel better. So if you can just get them to give strengthening or something else besides mobility and stretching a chance if necessary, that will really connect it for them and be kind of the missing link. Then, stuff starts to fly pretty quick after that for a lot of uncomplicated cases.
Yeah, I kind of want to transition a little bit towards clinical, Katie, like in your office, your office, which I think is now 5 years old, right? Just a few days ago.
Well, the clinic is
Practice.
5. Woo!
Yes.
And then the office that we're at now is 2 years. We hit that too. Like, might as well just throw everything together as one. But yeah.
Congratulations. That's
Thank
awesome.
you. Yeah.
So I kind of want to know that transition, and if anybody like on Instagram is listening to this, because if your followers are listening, they kind of want to know the difference between, Instagram Katie and if you see Dr. Katie Clare in her clinic. And I was hinting at this before. I know these are two different scenarios. So I kind of want to know more about what you do in the office personally, and again, still connecting to my original question of how you've morphed over time. Has the Instagram like stuff that you've been working on changed you at all in the clinic at all, with your focus or your time, or do you still feel like you have this balance between what you believe, the patient needs and in general?
That's a great question. Okay, so Instagram Katie and Dr. Katie are pretty similar, because I felt like it'd be really weird if I was one way on social media and then someone came in and I was like complete 180 from that. Like,
just cupping everyone.
Yeah, exactly. So no fun in the office whatsoever. No, but people come in and it's like down to business with it. And then we'll kind of rock through our eval, get through all the nitty gritty with it. And then it's just like a lot of like BSing. Tell me more about yourself. Like, sarcasm gets to kick out a little bit more, all that fun stuff. But I think when people come in, like, it's down to business. Like, you're paying me to be there. We need to figure out what's going on with you. And I would say, I always joke that I have like a terrible business model, because it's like, I don't want to see my patients for forever. So you get in, we figure it out, give you the tools to handle it on your own, hopefully pretty quickly. And then I always say, like, I'm super excited when I see my patients again, but I don't want it to be for the same thing. Like, so it is a work hard, play hard, I guess would be the best way to describe it. What people don't get on Instagram is that I do, a sports chiropractor. So I am doing manual therapy to some extent with it. And I think that sometimes people just aren't expecting that. But generally how my flow goes is kind of a bit of manual therapy, get them up and moving, and then work through exercises as well. And it's not going to be some huge long Instagram posts is their rehab work, because again, patient compliance, like, I just try to keep it to like 3 to 5 to start off with and then build it from there. And so I guess that's kind of like how I progressed, or that's where I'm at now. Where I started was in really manual therapy heavy clinics. So
Mm-hmm.
it was like ART for 10 minutes, adjust them, see you later. Everyone got the same paper of this is the exercises that you're going to do. And that's just kind of the practice that I was in. Didn't really love that either. So I keep pulling from different experiences to try and morph. And I would say I've gotten more into the rehab, prehab as time has gone on. So less manual therapy, more active modalities, active therapy. So I've moved from passive to more active. I've seen that progression in myself.
Yeah, I made that same jump. And as you're hearing your story, it made me think of the Joe Rogan podcast. So he had somebody on recently who was like a degree in religious studies or something, but they weren't talking about religion. They were talking about more of the woke nation and politics and stuff like that. But at the end, they got on chiropractors again. And I don't know if you've heard Joe Rogan kind of bash chiropractors in the
I
past.
know this happens, but I have not heard it personally.
Okay, it was a big deal a few
Yeah.
years ago when he did, but they just hit it again. But at the end, after they smash it and they put us in the same bucket as a bunch of other charlatans, at the end, Joe Rogan did go, but I just want to clarify that not all chiropractors are the same. Some do sports stuff, some do manual therapy, some do rehab. And he mentioned cold laser, which I kind of chuckled because he was throwing that around as it's some, super rehabby thing that's
Yeah.
evidence-based, but maybe a little bit. But anyway, he gave a little bit after they bashed it for like 25 minutes.
Mm-hmm.
He kind of gave that little last bit. And I kind of wanted, maybe you're a good person to say this because we have chiropractic degrees and you have your Instagram kind of following and image, and you have you in person for the local people in the Minneapolis area that come see you. And like, what is that difference between chiropractic traditionally and what you do? And because I still living in Iceland where chiropractic is very uniform because there's only like 25 of us here.
Yeah.
I've always told John I feel like I'm selling furniture in an Apple store. Like, even though it's really good furniture, people are like, that's a great couch, but I want an iPhone. Like, I'm here for an iPhone.
Yes.
And I'm like, okay, damn it. Like, I really need you to do this. You need a couch. You're sitting on the floor at home, surrounded by Apple products, but you just want to buy another Apple product. So maybe you can touch on that a little bit. And one last caveat would be, I don't have as much of a problem with traditional chiropractic as maybe some do.
Mm-hmm.
And that's only because I've seen so many patients that won't, you said 3 to 5 things. I've had patients that won't do one. So those people that won't do one, go see the chiropractor because they might help you a bit. They might get stuff moving because you're not going to move for yourself. Mm-hmm. So, I mean, if take metformin if you won't stop eating cake when you have diabetes. Like, at least you're doing something, you know what I mean?
Yes.
And that's why I'm glad those people still exist. So I'm not so anti, but I do want to distinguish the difference between somebody like you and traditional chiropractic, which people have an image in their mind.
Totally. And I think this is like a lot of where my patient base has come from too, is the traditional chiropractic. So there's like this whole movement of like evidence-based chiropractic, which I really feel like are the folks that are starting to tie the chiro, the physical therapy, and the massage, like if it were all or personal training, like if it were all just to come together. I feel like that could be a whole profession in itself one day. So it's kind of this evidence base, which is going to be a lot of pulling from, physical therapists have done a pretty good job of researching the things that they say. So now we've kind of started to pull into that a little bit. So not, traditional chiropractic, cool, has its place in things too. It's just when people are, and I would say for any profession, PT, chiro, like if you're not getting better at some point, like what are we doing here? So I get a lot of people that I do more mobilizations, or they come to me and they're like, don't crack, like I can't handle my neck being cracked. I was like, that's fine. I have like 17 other things that we can do that's going to accomplish a lot of the same. So I'm not going to force that on you. Now, that being said, after the pandemic and everyone is just like a structural, like everyone's just, they're stressed out. They have a terrible work from home situation, like setting. What am I trying to say? Ergonomics. Yeah. Mm-hmm. I have found that I have been doing just like a bit more adjusting than I have in the past, because it's like everything hurts on people. So I'm gonna adjust, I'm gonna adjust, mobilize, get stuff moving again, and then hone back in on that hip issue that they're having or whatever it is. And that's been a new kind of growth, which is weird to say for a chiropractor, like, oh, I'm adjusting more. But I'm just doing it a little bit more. I wouldn't say like full spine unless they're having an issue for real, through all three segments. But I have become just a little bit more broad in my approach with it for the people that are coming out just feeling beat up in all ways. So that's kind of been cool too, like to go back to the basis a little bit on that, but still getting a ton of the manual therapy and the rehab to reinforce the passive movement that we've gotten.
So no, that makes perfect sense. Like, so let's just say a patient comes in to you and you're on your door, it says chiropractor. Generally, do they know you? I mean, from your Instagram? I mean, I think what Bobby's saying is that basically like Bobby and I are both kind of fighting it. Like, yes, we are chiropractors. I know, snapping necks and cashing checks. Yes. But it would be really good if we could teach your hips to hinge a little bit. You know what I mean? So do you find that transition from traditional, I see you, I see that you're a chiropractor. And in my head, a chiropractor means snapping necks and cashing checks. How do you get, or is it easier for you being Dr. Katie Clare on Instagram to get to, we need to give you some active care?
I would say easier, yes. But I've also built my practice where I was segueing and missed it was that people come in and they're like, oh, I heard that you aren't going to crack my neck. Like, cool. Like someone has sent them in already. Like she's not your normal chiro. So that's a cool spot to be. And then a lot of people that do find me through Instagram that have like not the super crazy cases, but the cases that they just needed to find someone, like, I'm here because you seem different. And I'm like, yep, perfect. Let's do this. So I don't get a ton of people coming in, and it's also my website, my social media, who's sending them in. Like people aren't coming in thinking that I'm traditional chiropractic either. A lot of times they're kind of confused. They're like, so what are you? It's very obvious what I am, like, marketing wise.
So like, yeah, but what is your response to like when someone's like, what are you? You're like, I'm different. Like, what is your response to something like that? Like, it's my first visit with you. Yeah.
So I always differentiate myself as a sports chiropractor. I think that I have my certified chiropractic sports physician certificate. So more, postdoctorate schooling on that. And that brings me to the realm to say sports chiropractor. And then people are like, well, what's the difference there? And I launch into a lot of, sports injuries or a lot of musculoskeletal tendonitis, tendinopathies, sprain strains, overuse. And that kind of gets that conversation going. So they know they're here for muscle as well. And I think a lot of people just do chiro spine, maybe nerve if they're real woke with it. But like that soft tissue doesn't quite get in that circle of things. So the sports chiropractor helps me open the door and have that conversation with people.
That's awesome. I'm so like, and so then they buy in pretty quickly because for a lot of us, let's just ask this, for the rest of us who are not as popular as Dr. Katie Clare on Instagram, like how would you, I don't know, you even got into it, like the way that you market on your website and your Instagram, you've kind of built this thing that works towards your kind of skill set and a good one and an appropriate one for the things that people need. Like as a chiropractor, perhaps a new doc that's out there, like what advice would you give them to start going that direction? They're like, man, I know I want to do some exercises. I do some manual therapy, but that conversation is kind of tough in the beginning. Like, what advice would you give doctors who want to kind of move that direction?
I think in the beginning, I always say like my social media has taken over me needing to like get out and do hands-on marketing events. So I would never be, a lot of chiropractors are familiar with like spinal screenings. Like that would have never been something that I would do or feel good about. But I would go in and do like mini treatment sessions at like a gym or something that I've connected with. So that's probably going to be like a myofascial release, like you know, it's not massage because we're beating them up like a little bit more aggressively than that. But that gets people thinking like, oh, Dr. Katie does hands-on stuff. This is a taste of that. And then kind of rolling that way. So that's where my social media has taken over, and that I don't necessarily need to do that because I've already put that out into the public. But that's kind of what makes me different. But I would say those events were still like what brought in a lot of my patients in the beginning, and my really good patient, like referral sources are still the best have come from those hands-on things. But otherwise just working on the knowledge. And I'm not one that thinks that you have to have like the alphabet behind your name, but having some sort of certification, whether that would be the CCSP in the chiropractic world, or your CSCS, like your strength and conditioning something, at least then other providers, if you're going to start talking to people, can put that together. They're like familiar with that. They know a little bit of that base that you're coming from. And then just making a bunch of connections in the community. Like, I love social media, but it really still is a lot of the handshaking that you do with people and who you're meeting for, well, pre-pandemic for coffee, or, you know, just talking one-on-one with people. So forming that, but then also figuring out what your ideal patient is. And not that you don't have to get super focused on it, but then at least people reading your website are like, oh, like she's probably not going to be someone that wants to see me once a week for the rest of my life, that's fine if that's what you're looking for, but you're not getting that vibe from my website, and you definitely don't get it from when we talk the first time either. So kind of that's how I would approach it.
No, that makes sense.
And since you have your own business and everything, could you mentioned it a little bit about this business model issue. And I mean, how do you, like, imagine we have some chiros listening, which I think that's actually most of ours would be, you know, that are I think some people get stuck. Some people like the high volume, that's fine, and they're great at it, and you could just tell those people are meant to do that. But then there's others that kind of struggle because either they don't believe their message, like you've hinted at before, so therefore that doesn't come across as well, and they don't get as busy. But it's so easy in my mind. I can see these chiros starting off in a high volume model and then somehow trying to convince themselves that they should switch out of that. But then how do they pay for their boat and their car and their, all the stuff that they have lined up because of their, 100 patients a day model? Could you just touch on the idea of like, how is it possible? Are you cash based only? And, is there a bright side to going that way? Because I do think there's a lot of reward in the way that you do things, and it's also apparently viable even without your amazing Instagram. I think you were doing well before that.
Yeah. I definitely would be small volume. Like, there's no high volume at all. I run half-hour appointments, sometimes an hour if like someone's like really feeling sassy and just wants a lot of time. And would I say, like, if I were to break numbers down, like, is that the best option? No. Like, I'm not making,
monetarily.
Yes, monetarily. Yeah. But it drives me and it makes me excited to go to work. So I think that's a big quality of life issue too. What I have done is try to keep my overhead as low as possible. So I think a lot of times in school, like the sparkly factor of like walking into a clinic, like it was kind of like driven home to us, like you need to have a good clinic face, like you need to have someone like greeting people at the door, like you need to have all these things to like make it look legit. And I think just with how technology is right now, like I'm basically like one woman show. Like there's no front desk. I have a business partner and we split the overhead of our clinic. So we've been able to keep costs really low that way. Trying to think what else. I'm like the ones that I'm getting back to you if someone's calling in on the phone eventually, but we also have everything that drives them that they could do everything online to get in if they needed to. I do still take insurance, some plans. I would love just to do cash all day, every day. I think you really have to figure out if it's feasible in your location and then crunch those numbers. So I always say, like, how I set up my whole business was like, what's the goal? And then work my way backwards from there. So then I need to see X amount of patients and I need to collect X amount of dollars. And then is this, like, can I make that work? And I think a lot of people will come, not a lot, but I know some colleagues that have come at it from this is what the cost is going to be. And then this is how many people we have to see to make this viable. And they were super stressed out when you were forced to shut down for a month, like, so I get that too. So kind of bringing it from a little bit more of a business standpoint. And if you're going to go out on your own, like, you're going to have to do that. You're going to have to do that research on your own too. Because there is a way to swing it that we're not quite taught in school, nor should we have been, I guess. Like, we didn't go to business school, so you're gonna have to do the extra research on by yourself to figure that out. But it's very viable. And if you, I always joke that like I would be a terrible employee. So like I knew that I needed to get out on my own pretty quickly. So I was willing to do whatever I needed to do to make that work. So it was a lot of Saturdays, a lot of hands-on stuff, a lot of just like meeting people and trying to build that base.
That's awesome. And I think when I look at what you've done, you can see the personal touch behind it, the thought that goes behind it that you can't do as an employee. And I think one of the sacrifices I make as like a vagabonding expat chiropractor is that I do sometimes have to take what I can get, which is puts me in positions of selling furniture in Apple stores, right?
Yes.
And if you feel like that, I think you're a great example of what's possible if you have an image for what you want to do. You don't always have to, like for me too, and I think there's people like me that think, well, I don't really want to run a business. I see how chaotic it is. But you just explained, we don't even have any overhead. I don't have this huge staff. I kind of make it easier for them to schedule. And I actually love your clinic, that like an industrial look with like the garage door that goes up. It looks like that's a place I would want to go to personally. So it just, I think if people thought outside the box, you can understand, I don't have to have this standard chiropractic model where, the shelves behind the front desk are full of files and there's phone calls all day long. And, that doesn't seem right for me. So I'm just going to take a job. But then you take a job where you don't have any, not just autonomy, but the ability to create and do things that, so anyway, I'm slightly envious of your position in a way, but I do love my, my mountains out my window right now.
No, totally. And that's like, I always say, like, some people know that they'd be terrible employees. And then other people are like, like I have an associate and like that role fits really well. Like, and when I keep going back to the pandemic, because it's like the most, on the forefront of my brain, I was like, if I never had to make another decision, I'd be okay with that. Like, do we stay open? Do we close? What do we do now? And I'm like, man, like, it'd be sweet if someone just told me like, this is what we're doing. But then you are that person, like you're the one calling the shots on it. So there's pros and cons to it all. I think if I could find like a really great fit of someone that let me be what I'd wanted to do fully, like, I don't know, some days I'd be like, yeah, let's do that. But then other days I wouldn't change it for the world. So, pros and cons.
Okay. So let's finish kind of on this. Your Instagram is insane. It wasn't always insane though.
No.
Do you remember and I have to assume getting to 200,000, there were a couple moments where you had a couple posts or something that kind of took you to the next level. What does it take to be on the top of a mountain, Katie? Like, can you start us in the kind of the beginning before it really got rolling, where you're, but where were the kind of leaps for you? And what is it that you kind of, do you have some rules for us? Like, how do we be you?
Hilarious, because I specifically remember I was on like a family vacation. It must have been 3 years ago. And I was like, everyone needs to make an Instagram account and they need to follow me because I am almost at 500 followers. And like something opened up if you hit 500 followers. So my parents like follow me, like they don't use Instagram at all. So I remember that happening. And then I don't remember when it switches. Like it switches from, it counts, I think when you hit 10K, then it just goes to like 10K or something like that. So I remember that being like big deal. Like it's no longer giving you like the one count on it. And then I remember like really making a push. And so like the push with Instagram, I used to kind of have it figured out. I've gotten a little lazy with it, which is not lazy. Different priorities have taken over. But it really is consistency. Like you're posting daily. And then like quality content, and kind of, as I alluded to in the beginning, like you make content for things that, I mean, stuff that you can stand behind, obviously, but it really isn't for you. Like, it's for the people that are viewing you or come to find you. So you got to give them a little bit of what they want too. Cause if I mean, I can post about super abstract things that nobody cares about. Like, that's fine. It's always the really simple stuff that blows up. Like, I remember it was a chin retraction video that I was like, as I'm posting, I'm like, this is stupid. Everyone knows this. No, like, it took off. It was like, people were super thankful for it. It like kind of catapulted me to whatever level I was at that point. So you want to keep it simple, which is really what I try to do with it. Like, I don't want to be the super scientific abstract one. Like, I want to bring it down to a level that's like easily digestible for people. And so those are kind of like my three things, like consistency, quality, and then making sure that it's content that people want to see.
I have just a little follow-up, which would be the pros and cons of your Instagram itself, because like sometimes people will find out, like my wife has Iceland with the View, which she made out of nothing kind of by accident. And then now she loves working on it and she's got followers and stuff. And people will find out about her success and they'll go, oh, I should make a site about traveling to Arizona or something. I'm like, great, start it, write on it every single day, never miss, spend tons of hours after work posting every single day. And then maybe in 2 or 3 years, yeah, you'll get a kickback from Amazon from it. You know what I mean? So I hear them say, I want this. Like, I want to do what Katie's doing. So and I want to do what Jeannie's doing. And I think they just don't know what it takes. And when you tell people what it takes and they're like, I really didn't want to do that actually that much. So in a way, like, what are the pros and cons of you having this following and doing this page?
So like, I intentionally kept my head in the sand about it because it was however many hours I was putting in, like part-time job, no questions asked, like hours on hours. And now I have it kind of more streamlined, but I was just actually looking at something. It was like a repost that I kind of like revamped a little bit. So I didn't have to like do new videos, and I already had a little bit of the content that I was going to put into the message. And it still took me an hour, a solid hour. That was like with everything at my fingertips. Like, oh my God. So that's like the most, a lot of people reach out and it's super frustrating that they're like, oh yeah, you're at whatever the number is. Like, that must've just happened. I was like, if you come at me, I swear.
How long have you been at this? I mean, you're at 200,000 something now.
How much money did you spend to get those followers?
Yeah, I bought all of my, no, I did not buy any
Russian
of my followers.
bots.
I think it's been 3 years. And I probably didn't really take it super seriously until like 10,000 followers, maybe. I remember that I actually DM Jacob Harden. I was like, hey, is this going to turn into something that's helpful for my practice? Because it was like cool to spend the time doing it, but if I wasn't going to see any benefit from it, like, what's the point in doing it? And he was like, yeah, just hang on a little bit longer. And with that, then people started to kind of comment, like not hordes of people, but people are like, oh, I found you through Instagram. Cool. So it really drove like my in-person stuff. But yeah, it's so much time and effort. And I think now, as I kind of took a break, we were on vacation and it was like so great just to totally disconnect. It adds a little bit of stress factor. Like if you're like, oh, I'm not going to hit this post, or I'm going to miss this, or like, do I really want to post or reply to comments right now? Like, it really turns into a bit of a grind with it. Like anything, like it's discipline over feeling like inspired to do it. But that being said, like, you kind of ebb and flow with that, right? Like, I do enjoy it for the most part and find inspiration, but some days it is just a grind. You're like, all right, just put it out there and get her done.
How long would you say you spend on a post? Because I mean, some like, I actually saw one of Jacob's posts the other day, and the dude wrote like a novel, and his videos, I don't know how much time he spends on Canva and like editing those things out, but like, the dude put a lot of work into his post for sure. And having barely scraped the surface on our Instagram, I know it can take some work, but like, how long does it take you to make a post generally?
It's probably like, I break it up now. If I were to like just sit down and do it, it'd probably be like an hour and a half to 2 hours per post. Like start from scratch, don't know what I'm going to say. Cause it's just like the videos and then recording the videos and then the cover photo and then what you're actually going to say in it. Cause people apparently read the captions. So that's important. Yeah, it's probably 2 hours easily.
Yeah.
But I break it up. So hopefully it doesn't feel, I try to batch it. Like I try to like record a bunch, not a bunch, but videos on one day and then kind of come up with what I'm going to do as opposed to like recreating or creating every single day.
Gotcha. So
which that's a good hint. That's good for people.
So you like, you have a lazy Sunday and you're like, oh, I've got a couple ideas. And so you'll plan posts out for the week or is
if
that
I'm really
saying?
on my game, yes.
Yeah.
Sometimes it's like Tuesday night and I was like, oh, I need to post something in like a couple hours and we'll throw it together then. But when I'm on my game, I like have stuff planned out for the week. I record it all at the beginning of the week and then it's just much easier to go through. But I don't want to shed a false light on myself. I'm not that put together most of the time. So
That's awesome. No, go ahead, Bobby.
Well, I was curious about, I think when I talked to you not too long ago, you mentioned that you were trying to do some more work for your followers. Like, are you creating any more content in a different way? Something that's deliverable? Like, are you making a books? Are you doing anything else? Working on anything?
Yeah. So I have an ebook, which was just kind of like my first go around, just low back and hip programming. And it's kind of like that baseline that I give a lot of people that come in with, like non-specific low back pain or like hip discomfort. And so that's ebook, pretty straightforward videos, me chatting, kind of lays out a program for that. I would love to do more of like a course and like, as I've been like, everyone wants mobility, like give the people what they want. So I kind of want to do like a hip mobility course, and just kind of some stuff that way that I can release to people that maybe they are the ones that know that them going in somewhere every couple of weeks isn't going to be helpful. They need just a program they can follow at home, and giving those options as well. So I do have a couple things, but I think I've had a lot of providers reach out. And so maybe like a course, webinar, seminar, virtual, is something I'm kind of playing around with in the back of my brain too. So what
are providers reaching out about?
It's honestly like a lot of people are like, oh, I use your exercises. They're like, this was a great one to kind of turn over to my people too, which I'm always like flattered that other providers are finding it helpful. And so just kind of not an exercise like database, but just something to kind of like give some people some inspo if they want it to.
Cool.
Yeah.
Yeah.
Awesome.
Well, we have to have you back on, I think, because we didn't even get into some of your interests. I know they have to be like the neck and the shoulder and headaches. And I think some of that came from a little bit of your own personal journey, right? Sometimes we find passion where we've struggled with our own injuries and our own bodies.
Yeah.
And anything else that if you come out with some content, we just want to bring you back on and talk about it. It'd be fun.
Yeah, I would love it. Big fan, you guys. Big fan.
We're a big fan of you. I can't tell you how many exercises. I'm like, I need some inspiration. What does Katie say about your thoracic spine mobility is on point. Like there are so many. It's a hard thing to get at for whatever reason. It's a hard thing for people to feel, I've found in clinic. And legit, I have gone to your page and I'm like, I feel like every time I see there's a thoracic spine mobility, maybe I'm just going on Tuesdays to thoracic spine. I don't know what it is, but I'm guilty of stealing your stuff and using it in clinic. So thank you for me. I know there've got to be other providers out there that steal from you and helping people. So, I mean, with that, as many people are seeing your stuff, I mean, I really do appreciate you putting stuff out there so consistently because it's helpful, legitimately.
Thank you. And that like, honestly is like kind of the fire that keeps the drive going sometimes. I'm like, does anyone care? And then people reach out and I was like, all right, universe. But that being said, you guys have like, I feel inspired me, as I was kind of mentioning before we started recording, like I always pick up something from either you guys or who you have on. I appreciate it. My next thing is like the rib cage. You guys talk about rib cage a lot. I was like, I need to do some learning on that. So appreciate you guys too.
Well, I think that's the perfect note to end on. The blessing of Katie Clare on this podcast. I think that's the most important thing to end on. But yeah, if you guys haven't followed her on Instagram or bought her ebook or her upcoming webinar, e-course, get on that. I don't know, whatever. Find her in Minnesota if you're around. But thank you so much for coming on. I really do appreciate it. And we'll definitely have to do this again and get into some nitty gritty sarcasm stuff, you know, clinical nonsense. But
For sure.
thanks for having us. Don't know what I'm saying. Got my own podcast. But thanks for tuning in. Tune in next week. We'll see y'all. Peace.